Hi, everybody. I'm Dr. Szoka. Thanks again for inviting me to be part of this. Just following up on our last discussion about how to engage more people. Again, this is the choir. So I think one possible solution is putting these talks into the other sessions. So, we have, 6 slots here. Just put it right in the middle of that bariatric, that foregut, 1. Boom. Someone in the exhibit hall, one of the leaders, wanted to put Peloton and some REI stuff in the exhibit hall next year as trying to integrate our surgical and our personal interests so that this technique would flow perfectly with that. But in any case, today I'm going to talk with everyone about the LGBTQIA community. And I struggled a lot with formatting this talk because, again, with this DEI space, what is the audience? What level do we start the discussion with? So I'm guessing most people in this room are actually quite savvy. So if this is all too simple, just yell out, it's too simple, let's talk about some more stuff. But I've spent a lot of time figuring out how to go from here. So again, here are my disclosures. Nothing to do with LGBT people, really. So this whole acronym, it's like Scrabble, right? All these different letters. I start to forget what they all mean. Let's just start, and I don't think I can get across the whole thing. So lesbian, gay, bisexual, transgender, queer questioning, intersex, maybe asexual ally. So this is too many letters to use in your daily conversation. The NIH is starting to move the terminology towards sexual and gender minorities. So again, SGM. And this population, I just want to give you a framework to think about it more, both for patient care and for at work. So think about it as two different populations, really, and that we're not even including like genetically diverse, so intersex, but number one, gender minority as a part of it. So that would be transgender individuals, also gender non-conforming individuals like myself, as well as sexual minorities over here. So right and left hands, peanut butter and jelly, 2 separate, completely different groups that actually have nothing to do with each other. They could be completely distinct. And so to take this analogy further, again, the gender minority group is going to be in the blue above. So when we think about gender minority population as a provider, we are looking at these variables: someone's biological sex, their gender identity, and their gender expression. Again, we'll talk about those things. And then, again, separate community, might not have to do with each other, sexual orientation, so sexual minorities, SM, it could be your sexual orientation and your behavior. And so again, just flying through these definitions, I'm pretty sure you guys know this already, and I apologize. Maybe we can put this talk in the middle of the other talks for all the people who aren't here, and that would be the appropriate level next year. I can just reuse this. But again, biological sex, sometimes defined on people's birth certificate, female or male, usually assigned at birth. Interestingly enough, this is from years ago now. Colorado is one of the states that actually allows people who are not, XXXY, so women and men who may be intersex, to have a different space on their birth certificate. So again, I'd say our Western culture is overly binary about everything, and it's probably not good. But even within this sex assignment, it's not binary. So usually determined by these things. So gender identity, again, is how people feel about their gender on the inside. You can't see it, I can't see it, you can't know it unless you ask someone. And so cisgender means your biological sex, meaning the sex on your birth certificate, aligns with your gender identity. Transgender, that biological sex does not align with how you feel inside. And then for gender nonconforming individuals like myself, you've never really felt one way or the other, and up until probably the year 2000, you didn't even have a word to describe it. You just know, when I was in 6th grade, my parents took me to the Gap to buy some clothes. They bought me the girls' Gap clothes. I hated going shopping. I never knew why until maybe I turned 30 and was like, I get it. I don't want to wear the girls' clothes. It has nothing to do with my body. I like the body I'm in. So then gender expression, just kind of segueing into that, is someone's external expression of gender. We talk about this all the time and we don't know it. When you're with your friend, you're having a drink. I'm a parent, so I don't really drink anymore. But when you're like at that little bar, you're like, hey, what's your type? You know, what's your type? What kind of people do you like? And that person may say, hey, I like the nerd boys, or I like the skater dudes. I like the jock guys. I like the lumberjack guys who wear the flannel and have the beards. That is gender expression. Or maybe someone says, I like the cheerleader girls. I like the tomboy girls. I like this and that. That's all gender expression. So we all use it all the time. We've just never really had a name for it. But that's someone's external expression of gender. So again, these things for gender identity come together. So this is just an example. Cisgender people, their birth certificate, their gender identity, their gender expression all align. For a transgender individual, again, there's a discordance between their sex on their birth certificate and their gender identity inside. And then maybe outside, initially when they're born, their gender expression doesn't match with that. They may go through gender affirming care or therapies and make that concordant. And then again, for us non-binary people, I should have put my pronouns, so it's confusing for some people. I use she, her pronouns, but again, for people who are non-binary like myself, we don't have a problem with our body, our biological sex. We're fine with that. But the way our gender feels inside may be in between, and that may lead to us presenting for expressing our gender, sometimes more masculine, sometimes more feminine, maybe in between. So again, that's the gender group on one side. The next is sexual orientation and sexual behaviors group. So again, we would say those are lesbian, gay, bisexual people. You know, the Gallup survey says about 5% of Americans are this group, millennials a little bit more. But a lot of other Americans have behaviors where they may have same-sex sexual behaviors. They do not identify as lesbian, gay, or bisexual, but their behavior may be that. So almost 8% maybe have had those behaviors, and even more acknowledge about being attracted to the same sex. So that's showing us that, again, orientation and behavior are also different variables. So this is just how, again, to think about when you're with your patients, they have these different things going on. And if I want you guys to take anything from this talk, is just this. So historically, this population has a deep mistrust and fear of healthcare providers. Why is that? Well, homosexuality was in the DSM until 1973. So for the, sexual minority group, it was considered a disorder. They're worried that they're going to be discriminated against by their healthcare providers. Within the transgender community, again, this could be a whole talk on its own. Within the gender kind of identity group, a lot of them have no insurance, have laws against them getting actual insurance that will cover gender-affirming care, and have horrible experiences at the physician office because they are misnamed, misgendered repeatedly, despite telling their physician how they want to be addressed, and we'll talk about that later. So just to reiterate, about half of sexual minorities have had discrimination in a healthcare setting. About 70% of transgender people experience that. And then throw in that most providers aren't comfortable with this. They aren't comfortable working with this group. Let's throw in the intersectionality, which our earlier speakers brought up so importantly, that layers of things can stack up to create more problems. So again, this slide, you're looking at the blue is showing low income group. The green is kind of regular income group. And the left side would be the LGB, and the right side is the gender group. What we see, number one, is that low-income individuals experience more discrimination in the healthcare setting than normal income, and that, both the LGB and even more so the transgender patients just experience the most. And throw in the low income, they stack up. So, I think this paper has already been floated up, or no, it hasn't, that in cancer patients, this study showed that half of people were not comfortable coming out to their surgeons, and that most people disclosed their identity to their surgeons to correct an incorrect assumption. So realize your patients are probably intimidated by you. Again, in medical education, we are struggling because there's not a lot of modules to teach medical students, residents, appropriately how to address this population. I've had, unfortunately, some of my trainees call a transgender patient "it" when they presented the patient to me. So just to wrap up, when you're working with patients, really just ask them, this could be all your patients, what's their preferred name and how to use that name. So especially if maybe you see a patient where they have a male name in their chart, but you walk into a room where they appear more female, would be a classic thing where you say, hey, what's your name? But you could use this for all your patients. It doesn't need to be specifically this group. And so again, just asking your patients, what's your name? What would you like me to call you? And then, what pronouns do you use? Believe it or not, these simple things can build trust between you and that patient. So just to kind of wrap up, I think avoiding assumptions as a provider is the most important thing you can do. Not assuming that they are cisgender and heterosexual, encouraging the safe space at work, the way Dr. Altieri discussed about addressing microaggressions, and finding appropriate teaching moments to bring everybody together and working in a constructive manner on this issue. I'm glad I just put the fish tank at the end. This is the original fish tank.